Use it or lose it. A deadline looms for the state to spend billions of dollars in CARES Act money, the effort to get the funds to people in need before time runs out. COVID-19 takes a toll on the Texas economy, but find out why the impact on the state budget might not be as bad as first feared. The pace of Operation Warp Speed has some Texans worried about the safety of the COVID-19 vaccines. A doctor who's shaping state policy answers those concerns.
I will have no reluctance at all telling my mom and dad when it's their turn that they need to get immunized. When it is my turn, I will get immunized.
A message from health leaders as Texas prepares to distribute the vaccine. Hello and thank you for joining us for State of Texas. I'm Josh Hinkle and I'm joining you once again from home as our crew continues to social distance as the coronavirus continues to spread across Texas. In North Texas, the rate of people hospitalized for COVID rose above 15% for 7 straight days. That triggered new restrictions in Dallas County. The county halted elective surgeries, closed bars, and scaled back business capacity to 50%. Hospitals are near capacity in several parts of the state. The ICU at San Angelo's Shannon Hospital was full earlier this week as COVID cases rose in the area. A hospital chaplain is on hand to help families and those battling the virus. A program called No One Dies Alone has been instrumental for families losing a loved one during the crisis. The surge in cases comes as Texas prepares to distribute vaccines to fight the coronavirus. Federal approval for the fast-tracked vaccines could come in a few days. Wes Rappaport looked into how many doses are on the way and who will administer them.
Inside Texas hospitals, nurses are preparing to get the COVID-19 vaccine and give it to
role models in the community. When the opportunity becomes available for the general public to become vaccinated, that we were first in line, and now they can follow the nurse's lead.
Governor Greg Abbott announced this week Texas will receive enough material to give 1.4 million people an initial dose of the 2-shot vaccines made by Pfizer and Moderna, assuming the FDA approves them. First up are those healthcare workers. Look at how many there are in Texas based on a statewide estimate. More than 1 million healthcare, EMS, and hospital personnel. Nursing home residents total more than 135,000 statewide. There are close to 4 million adults 65 and older and nearly 9.5 million Texans with medical conditions that make them high risk for complications with coronavirus. Now, the distribution. The Department of State Health Services says more than 4,000 providers signed up with the state to administer the vaccine. That includes medical practices, hospitals, pharmacies, long-term care facilities, local health departments, and the correctional system. I'm told the first shipments will go to larger health facilities who can vaccinate the most workers in the shortest amount of time, but the rest of the providers who signed up for doses will get a chance to order in the spring when there's more supply. I'm Wes Rappaport for State of Texas.
The Centers for Disease Control recommended that people in nursing homes be among the first to receive the vaccine. They're at the highest risk of severe illness. But as Alex Capriello shows us, some people are not comfortable with their elderly family members being first in line.
Carla Baluch would love to see her 85-year-old mother again. The family, too. Baluch's daughter planned her engagement outside the nursing home window.
It would have been nice if my mom would have been able to hug her and kiss her. She did all the other kids.
But a vaccine on the horizon, which might help speed up the process, isn't something she'll encourage her mother to get.
I feel like, every drug and every vaccine has to be tested for over a number of years, and they're doing this warp speed thing, and to my opinion, they're maybe doing it a little fast.
All the data that I have seen thus far look like this vaccine is both very safe and effective.
Dr. David Lakey, who is helping the governor with distribution, says the vaccine will go quickly. So if you're prioritized, you should take advantage of it. He says the 1.4 million doses is based on the population and the severity of the outbreak here in Texas. He estimates it to be about 10% of the country's initial rollout.
I will have no reluctance at all telling my mom and dad when it's their turn that they need to get immunized.
Nursing homes are already preparing their residents and staff. Belmont Village Senior Living has secured an agreement with Walgreens and CVS to come to their communities to distribute the vaccine when it's time.
There's a lot of talk about the vaccine. They certainly want to know when they'll be able to get it, how quickly we'll be able to get it.
Alex Capriello, State of Texas.
You heard the daughter in that story voice their concerns that the vaccine trials may be moving too fast. It's something we've heard from other Texans during the rapid rollout and approval process. We asked Dr. Lakey about those concerns and why he thinks Texans should get the vaccine.
Obviously, everyone is concerned about any new technology, any new virus, vaccine that may come out. I would have people concentrate on the data. And so the FDA is going to be looking very hard at that data in the middle of this month. The CDC has already looked at that data. All the data that I have seen thus far look like this vaccine is both very safe and effective. There are mild side effects, sore arm, maybe some headaches, especially on the second dose, but those seem to be very minimal. No severe reactions that have been documented thus far in vaccine trials that are pretty large. At the same time, they were able to significantly decrease the number of people that came down with the disease, and were really effective at decreasing the number of people that had severe disease. And so I would put all of that into the calculation. And if I have to choose between what looks to me and many other people that are digging into this data as a safe and effective vaccine versus the risk that this can be a very deadly virus in older individuals, especially those in the nursing homes, I would have my parents immunized, and I will have no reluctance at all telling my mom and dad when it's their turn that they need to get immunized. When it is my turn, I will get immunized.
DSHS says that everyone who gets a vaccine will also get a card with information about which vaccine they received. Doses will be recorded in the state's immunization registry so providers and patients can make sure they get the correct second dose a few weeks later. Texans living in popular tourist destinations are frustrated with visitors, what they have to say about people bringing the risk of COVID-19 with them. Use it or lose it. There's billions of dollars in CARES Act money waiting to help Texans. Now some lawmakers want to know if the funds will get to people in need before the deadline. And later, reforming the juvenile justice system, how a promise from the Biden campaign could affect underage inmates in Texas.